My name's James Daly. I'm a palliative care clinical nurse consultant, and I work for the Western New South Wales Local Health District. And today here we are in Bathurst, and I've just been asked to talk a little bit about family conferences in the palliative care setting. And I guess in palliative care, we're all very much aware that good communication, particularly with family and patients and carers, is the absolute foundation of good palliative care. And the family conference actually provides a vehicle for doing just that. It provides opportunities for the clinicians to get a sense of the capabilities of the carers, find out where the patient, where their understanding is, particularly around their prognosis and treatment options. In itself, I think if it's run properly, engenders a sense of confidence and a sense that we're all here working together for the one aim, which is patient comfort and support, and provides an opportunity for the family, the carers, to talk about any concerns that they have and feel free to be able to bring those concerns to the table. So within a family conference setting, there's many things that are kind of going on at once. And I think one of the first questions is, when should we have a family conference? I think generally in clinical practice we find that most often they're based around a crisis. Something's happened, treatment perhaps has failed, or some catastrophic event has happened, and we need to sort of talk and convey information to people to let them know where it's at. That's only one position. I think another situation is, at the very beginning when we're not in a crisis situation, and perhaps we're just sitting down and just getting to know the family and getting to know the patient and finding out what their preferences are, particularly around the setting in which they prefer to die, and just have discussions around that. And also I think getting a sense of who's the enduring guardian and all that, and finding out where people sort of fit in the overall support for the patient. So the when, I think it's one of the other things about family conferences is that quite often they're informal, in the sense that particularly if you're working in the community, you just suddenly find yourself in a person's home and all the family there, and they're asking you questions, and there you have a family conference happening straight there and then. Being forewarned and forearmed, I think, is the rule of thumb, in the sense that if we're planning a family conference, giving a heads up to the family and the patient, letting them know that that we think it'd be a great idea for the family to get together and talk to the team, I think, and giving them a sense of what we want, what we're going to talk about, and give them time perhaps to think about the types of questions that they'd like to ask, and gives us an opportunity to find out what's really important for people. Also, depending on what the subject or the agenda of the conference is, I think we've got to think about who's got to be there. Like, who are the people that we really need to have at that particular conference? And I think that really depends on what we're really talking about. Is it more psychosocial, or is it more clinically based? And depending on the setting, obviously, is going to change who's going to be there. But I think that, as a rule of thumb, having broad representation from the multidisciplinary team is really important. In fact, I think it's vital. Having someone that's the convener, that's kind of running the show, in the sense that, this is what we're talking about, my name is such and such, this is my role, and giving people an opportunity to, identifying who's there. This is our clinical team. Everybody introduces ourselves, and similarly with the family that are there, they introduce themselves. This is the wife, this is the daughter, this is the cousin, this is the neighbour. It's really important, I think, that we give time at the beginning of the family conference to really get an opportunity for people to feel that they're there, they're being acknowledged, and we're there to listen. One of the things, there's not a lot of studies being done around family conferencing, but this, what has come through is that people really need an opportunity to feel that they're being listened to, and they need an opportunity to raise concerns. And if you're running a family conference and you find that it's the medical professionals that are doing all the talking, it's not usually a very good conference from the point of view of the family, because they really need to feel that they're able to be listened to. As I said, I think it's really important that we include all the people that need to be there, and even if they can't be there physically, today with the use of telephones or video conferencing, these are also really useful tools for us. I think also what we've also got to remember is that we need to document the outcomes of the family conference really clearly, so that these are the things that we've talked about. This was what was said, and that documentation needs to be circulated not only to the clinicians that were attended, but I think a synopsis can be given to the family as well, so they get a sense of what was discussed as well. I think that's really important. So just wrapping up, I think that family conferences are really useful as long as they're done properly, as long as that the family feel that they've been given opportunities to voice their concerns, and that they're planned. And if they're not planned and they're informal, at least that from the very outset that it's very clear what the discussion is about. Absolutely recommend CareSearch. You're probably already aware of just what a useful resource it is for palliative care. But here on CareSearch, you just look up family meetings. There's plenty of information there to be found, to do a little bit more research around how to set up an effective family conference. Thank you very much for listening. Thank you.